Good morning, everyone. I have with me our chairman for the council, Chairman Ricky Templett, Councilman Scott Walker, Councilman Dino Bonanno, Councilman Byron Lee, and Councilwoman Jennifer Van Rankin, along with Dr. Jerry Satanovich. Is he here? Dr. Jerry Satanovich hasn't arrived yet. Sheriff Joe Lapinto, our Superintendent of Schools, Kate Brumley of the Jefferson Parish School System, Todd Murphy with the Jefferson Chamber of Commerce, Jerry Bologna with JEDCO, Joe Valiente with our Emergency Operations Center, Tim Coulon with our Jefferson Business Council, as well as Colonel Scott Desimo. So with that, I want to start this morning. It's Friday, March 20th, with the number of cases in the state. We currently have 479 cases. Of those, Jefferson Parish has 90. We have 10 deaths in the state. Unfortunately, we lost our first Jefferson Parish resident the other day. The state has completed 1,047 tests, and this virus exists at the moment in 25 of 46 parishes. Again, and we say this every time, we're in the mode in our community of flattening the curve, getting ahead of this. That's why we see the social distancing measures that we are engaged in at this time, to be able to flatten the curve. And I know we keep saying flatten the curve. I want to introduce it in a different way today. And let's look at Italy, that was not able to flatten the curve. They came into this week, that country, with 25,000 cases. And remember, 20% of the cases are going to need medical attention. They're either going to have to go present at a doctor's office, a hospital, or require an ICU bed in critical care. 20%. They come into the week with 25,000 cases. And every day, they're adding over 3,000 additional cases. So every day this week, they've had to, their medical system is going to have to absorb another 600, 700. Just the other day, it went up. They're not peaking yet. 4,207 cases Wednesday. That's 841 more patients in that medical system. So it's critical that we do the things that we do so our medical system is able to keep up with the people who need those medical services. We want to address some rumors. I've been talking to council members. Everyone received calls from constituents, calls in the community about a shelter-in-place order. The Louisiana National Guard is in our community. They are doing drive-through testing and helping support the drive-through testing, and I'll go over that. Ours in Jefferson Parish is going to start tomorrow morning. But to use the word shelter-in-place, I don't think that helps the situation. A true shelter-in-place type of wording is in a different situation where you have to take cover in your home, like a tornado or an active shooter or some kind of chemical release. And until the government tells you to leave, you have to stay in your house for your own safety. Even if you look at cities that have had to take more strict measures, and I don't know what the coming days are going to be. This changes so fluid. It's so fluid, and we don't know how much community spread is in the community until we are able to get more test results in. But even the cities that are more restrictive than us, they have a list of essential reasons that you will be able to leave your home, to go grocery shopping, to go get your pet food, to go take care of a loved one. And of course, if you are in an essential service in the medical industry, so many industries that are deemed essential to keep our community going in this time. So let's all not worry about that word shelter in place, and let's all just understand that even the communities that are more restrictive than us, it is not people being imprisoned in their homes. It is not people not able to leave to go help a loved one. So let's just keep that where it should be in our minds, okay? So the Ilario Center tomorrow, starting at 8 a.m., will be our drive-through facility to test healthcare facility workers and first responders who are showing symptoms. That is the first testing that we will begin tomorrow. You have to be a healthcare facility worker or a member of the first responder community showing symptoms. Tomorrow it begins in Jefferson Parish at 8 a.m. This is a pilot program that we are doing with much assistance from the federal government and the state of Louisiana. You will be able to remain in your vehicle, and you have to show your ID badge, your healthcare worker badge or your first responder badge, and you'll be able to stay in your car, and they will take the swab for you to do that. I have spoken to our council, who has been so very involved and actually certainly helping me. I'm in meetings, and they're in meetings all the time, but they're also talking to their constituents all the day long. And they made it very, very clear to me, very clear, that they want to make sure small businesses are able to get through this time and that we help them do so. So we would work with them to say that, like I think of it as a post-Katrina environment where you're able to put up a temporary sign on the parish right-of-way to help your business advertise if you're doing a drive-through or a family pack, things of that nature. We want our businesses to be able to do that. Do whatever you need to do to get the public to understand that you're in business and that you're doing to-go. Add more signage to your building. We have strict sign regulations under normal times, but I have personally talked to our property and maintenance and zoning director to say no enforcement on that. Let businesses do whatever they need to do with signage to get the word out to the community that they are open for business. And of course, the council is very insistent on making sure that that happens in our community, and we will do that. As an employer, we are engaged in social distancing. We have sent some of our employees home who can work from home. We have certainly sent our vulnerable employees home, so we will continue to work through. We have over 40 departments in the parish. We are going to continue to work through that and refine that process. The water department has restored water that has been turned off recently, and I want to explain, and I hate to admit it, that I did not even know the absolutely incredible resources our library has online. So while you are at home, get on. We have waived the need to have a library card, so you don't have to worry about that. You're able to just sign up for a temporary library card. When I say thousands of movies, thousands of books in different languages, international recipes. I was looking at empanadas de carne from Argentina. Animated books for children. So those of you with little kids at home, there's a section for animated books. You turn it on and the book is read, and there's little cartoons. Articles from all kind of magazines, U.S. News, Better Homes and Gardens, Sports Illustrated, all of these incredible resources, research, genealogy, incredible resources on the library. I encourage everyone, no temporary library card, just at the click of a button, so please do that. I was at the animal shelter yesterday on the East Bank. Unfortunately, with the economic times that we have, and some people have had to surrender a lot of pets. And so we're seeing the surrender rate with our pets at a little bit higher level. So for those of you who can consider fostering a pet, the animal shelter certainly wanted me to get that out. I know the governor mentioned that banks are not allowed to foreclose on property at this time, and evictions will not be carried out. So that was from the governor. So I know that gives many, many people some relief with that. I'm going to invite other people up to give you their updates. I want to personally say, and you know, the visitor restrictions are at the hospitals, and those of us who are sick are not at the hospitals. I can't imagine that they are the frontline people with this pandemic, and I just personally, from all of us, want to say thank you so much for what you're doing. We know you're tired, but we know that what you do right now is so very critical for us in this region, and we are so very grateful for what you are doing. I spoke to a woman yesterday, and she said her daughter had a mask on her face for the whole day, and it's very difficult. So thank you so much for choosing the career that you are doing and then shining bright right now for us. And then businesses, employees cooperating so much. By and large, everyone is cooperating, and we are not having any issues. So I want to thank you for that, and not having to take our time to make sure people comply. We are a community that is coming together to fight this as a community. So with that, I want to invite, I will say, Dr. Brumley, Dr. Kate Brumley. I know he's been very busy with our superintendent of schools, if you want to give an update.
Thank you, Parish President, for your leadership at this time. The parent is the child's first teacher, and arguably that's never been more true than it is right now, with us all being remote. I would like to give some information on our grab-and-go meal sites that we have available. We have 14 sites that are available for grab-and-go meals. Individuals can bring their children ages 18 or under, or 21 or under if it's a special needs student, receive lunch for the day and receive at the same time breakfast for the next morning. We're averaging about 12,000 meals a day that we are serving, and we are prepared for that to increase as we expect the economy to also take hits. These meals are for children. Again, children ages 18 or under, or special needs students 21 or under. It does not have to be a Jefferson Parish Public School student. It could be a private school student. It could be a parochial student. It could be a homeschooled student. We're here to serve all of our children in this parish. We do want to encourage people to not take advantage of this situation. These meals are for children. If you're coming and you're expecting to get meals for adults at this time, it really does put our food supply in an unfortunate situation. So please adhere to the fact that this is for students in our system, or in private or parochial or homeschool, and this is not for adults. I want to encourage families to go to jpschools.org. That is your one-stop shop for all information about our school system, jpschools.org. Student learning is up and rolling at jpschools.org for individuals who have access to technological devices and the internet. We will continue to populate that site by grade level so that students and parents have resources available at that site. Our next set of paper-based packets for student learning will be available at the meal sites on March the 30th. March the 30th, we'll have paper-based packets again through 8th grade, and then we'll also have about a dozen high school courses available at that time in paper form. Do want to encourage you, jpschools.org, that is the site where you need to go. Parents, students, if you have issues and you need help with homework or other academic issues, we do have a setup for a homework helpline where we have employees manning that line. That number is 504-349-8999. You are not in this alone. Our employees are still here to support you during this time. You can call that number, 504-349-8999. Also, email addresses are available for all of our employees online. The governor's guidance that came out does not indicate that schools are closed for the remainder of the year. At this point, his guidance still indicates that we're coming back in mid-April. Should that change, we'll certainly get that information out to you as soon as possible. Finally, I want to inform parents and students that we will probably be over-communicating with you over the next few weeks. We will not go silent. We understand that some of you may think, well, I'm getting another email today. It's another phone call, another text message from the school system. But just know that we think that it's important for us, for our students to know that we are still there for you, not just academically, but with any need that you might have in this time. And one of the ways that we can ensure that is through communication to you. So know that we will be over-communicating during this time. If there are any questions, we have an FAQ site up at jpschools.org, and also that homework helpline can help you in a number of different ways. So thank you.
Thank you, Dr. Brumley. Next, I'd like to invite Sheriff Joe Lapinto up.
Thank you, Madam President. I'll be brief today. 911 services are continuing to operate as usual. As we mentioned the other day, we're taking restrictive measures within our department to make sure that we limit our exposure from our department, but our staff on hand has been capable of handling the services. Our calls for services are actually down right now, which we would expect. We thank the public for obviously complying with the ability to stay home. Brings our calls for service down, less exposure for our deputies that are out there in the street, but as of now, everything is operating as normal. Thank you.
Thank you, Sheriff. I know we've fielded a lot of questions about some legislation, potential legislation, so I'd like to invite Jerry Bologna with JEDCO up to give us a briefing on that.
Thank you, Madam President. On behalf of JEDCO, the Jefferson Chamber, the Jefferson Business Council, and all of the business organizations across the parish, one, we want to express our appreciation for our businesses that are heeding the call, that are operating according to the guidelines, even though we know that it comes at great personal cost to you. Our team at JEDCO is actively reaching out to businesses across the parish to gauge their issues, the issues they're facing acutely. I would encourage you all to go to the JEDCO website, fill out those surveys if you own or operate a business, because those will help, those responses will help us inform our response and how we can lobby and advocate for certain areas. The JEDCO Business Boost page is up and running. It's a complete resource for much of the information you need, including the data you would need to compile in order to file for SBA loan applications. The SBA loan portal is open as of yesterday, and those call for loans up to $2 million at a rate of 3.75% for businesses and 2.75% for nonprofits in terms up to 30 years. I also want to call attention to those of you that are business owners that are struggling to make payroll and having to face some difficult situations. One, I would encourage you to reach out to your private lender. We were on the phone with many of the bank presidents throughout the day yesterday. Most of the banks have already begun offering certain types of forbearance and payment options for their lenders, so if for their borrowers. So if they haven't reached out to you yet, please proactively reach out to them. Additionally, there is a bill in the U.S. House right now that has passed the Senate side. That's a bill by Senator Rubio, which does call for the SBA 7A loans to potentially become forgivable if those loans are being used to maintain payroll and pay rent and or mortgages. So I would encourage you to look into that and lobby your legislators on those options. There are some companies that actually are hiring at this time. So if you are someone in need of work, I would encourage you to go to the worknola.com website, as well as the Jefferson Chamber website, jeffersonchamber.org, where they're pushing out their newsletter with lots of information. So again, if you're a business owner, jedco.org is a one-stop resource, and we would ask you to please reach out to us online, register your business. Many of our businesses are operating under modified business hours, operating drive-through restaurants and walk-up restaurants. Please register those businesses. We have a portal that's a kind of a one-stop shop for everyone to know who's open, operating, and what the modified hours are. Thank you very much.
Thank you, Jerry. Any council members would like to speak? Yeah. Councilman Walker.
Social media is a crazy place. I think I can speak for all of us up here when I say that the frustration level with misinformation is about right here. I spent a good portion of my day yesterday responding to people who sent me copy and pasted texts or status updates from people who knew somebody who worked somewhere, who had a connection with somebody who was high up at a place, and it's all wrong. Unless you hear it coming from us or the governor's office, it's not here. If you ever do, like the parish president mentioned a few moments ago, hear the word shelter in place, then that's not a whole lot different than what we're doing right now. If you look at what's happening in San Francisco, or excuse me, in the whole state of California, right now, it's not any different. Drive-throughs are still open. People who are doing takeout are still open. Groceries are still open. Pharmacies are still open. You're still allowed to move out and about. All it does on social media is stoke fear when people put that information out there. It's not good for us. It's not good for you as a community. And overall, it doesn't help the entire situation. On another front, there's an effort online, somebody I've been in contact with, a lot of dentists in the metro area who are trying to collect masks for emergency rooms and for ICUs. There is a real shortage of masks. If every dentist who hears this or sees it on social media can donate one box, that helps 50 people, and that can go a long way. There are a lot of other needs, but that's something easy that dentists, is my understanding, can afford and can do, because they don't need them as badly right now as some other people do, because most dental procedures or surgeries are postponed at this point. And the last thing is our groceries. We have no reason to believe our supply chain is interrupted or in any danger of failing in a tremendous way. So give our grocery stores a chance to restock. Be smart. If you have what you need, stay home for a little while. Thank the people you see working in grocery stores and allow them to do their jobs, get things back on the shelves, and we can all get toilet paper again. It's not a major issue right now. That's the least of our worries, is our grocery store supply chain. So give them the time they need to restock. And again, use this time to reconnect with your families and the environment. I've never seen so many people out and about, of course, at a safe distance and sometimes alone. But use this time to to reconnect with things that you maybe lost a connection with, and try and take a positive out of this, as negative as it may be. Thank you.
Okay, again, I want to reiterate that our drive-through testing at the Ilario Center will begin tomorrow at 8 a.m. for healthcare facility workers and our first responders who are showing symptoms. No healthcare card necessary. Just stay in your car, get swabbed, bring your ID badge. With that, any questions that anybody has?
How short on masks are we within Jefferson Parish at hospitals? How short are we on supplies right now?
Well, they have what they need now, but everybody has a supply request in. We in Jefferson Parish have put a supply request in. I'm told that they get it, they get a supply, but I don't, it's an issue for us. But right now, I believe people have what they need. But we want to be prepared for the coming days.
Do you expect any parish workers to possibly be furloughed or make any adjustments as this is such a financial hit?
In Jefferson Parish, our employees are receiving a full paycheck and are going to get paid, and we're not doing any layoffs. We're being creative as to how they can work. We might have to reassign people, but no, our Jefferson Parish employees, we have the buffer that they're going to get paid and they're going to have a paycheck, and I sent a letter to all of our employees to that effect. Yes. Any other questions?
Can you tell us what's being done here in the parish to increase hospital capacity? Are there concerns about ventilators, personnel, and space, things like that? What's being done in the parish?
I'm in touch with all the different hospital communities. I think they're all doing different things. Some of them are opening up new facilities. Some people are shifting. Certainly, we have the state is taken over by Signet, so that's open. So we will see. I think those discussions are taking place, but. The real issue is what the testing results come back at. I don't think we have a true idea of the community spread because we still are only at, what did we say, just a little over 1,000 tests completed. And again, the first tests that came in were already sick people. So it's hard to see how much this has been in the population because those very first tests were people who were already maybe sick or in the hospital. And so as this next days come, and I'm told that it will open up with regards to testing now that the commercial testing is available and different supply chains are coming down and the regulations were relaxed. We're going to probably get a good idea of how much community spread we have had. And that's why the information is just so very fluid. Yes. Oh, Dr. Satanovich is here, so I'm going to invite Dr. Satanovich up.
Yes, good morning. Thank you. I want to extrapolate a little bit on what you just said. All the healthcare providers I talk to are working desperately to increase their capacity of both ICU beds and other beds. Regarding the testing, I want to get a message out, if you haven't already, that in the next few days, I don't know if it's going to be today, tomorrow, or Sunday, but in the next few days, I would caution everybody to expect the number of positives reported to really go up quickly. But I want to emphasize that the majority of those tests are 5, 7, and even 8 or 9 days old. The people that are doing the testing, whether it's Quest, the state, LabCorp, Mayo Clinic, are all overwhelmed, those labs. So because of that, they've not been able to do the turnaround that most of us have expected over the years. So, I'm told that those reports are going to come flooding in. So when they do, it's our responsibility to give those reports to the public. But please keep in mind that they're reflective of a lot of them are reflective of what happened last week, not today. And I don't think we're getting a good idea of the actual community spread for, I don't know if it's 1 or 2 weeks, but we've got to be patient and not overreact, or underreact to the tests we're getting. It's really important that everybody follows the instructions to stay home. I am a healthcare provider. So many of my friends are healthcare providers, and they really appreciate the community taking this seriously.
Any other questions?
Are there any other, with the drive-through center and the Ilario Center, will that turn into a public drive-through eventually, or?
So, what we always wanted to make sure with these drive-through centers is that the demand that we create matches the supply that we're given. And so at first, we want to make sure the priority is right. And certainly, we need to test our first responders and our healthcare facility workers, right? And once that demand is kind of filled, and depending on how many supplies we're going to get, we're going to widen that up. But right now, for tomorrow, it's just that narrow group. But absolutely, that's a facility that was set up. It's a pilot program that, New Orleans has 2 sites, Jefferson Parish has 1 site, to help ease the burden from our hospital communities. And it's an off-site location, but through working with New Orleans, through working with Louisiana, we felt the best criteria starting off is the healthcare workers and the first responders. And yes, as we move forward, there is every reason to believe that the criteria will be broadened. But it just depends on the supply that we get, the supply of materials. We want to be able to control it. We don't want people in line when we don't have the supplies. Now somebody's, more anxiety. So we just want to have a really, really good flow. And the supply that we have matches the demand that we create. And again, we're hoping that this week, many more tests will be available. And that's key. If you look at what South Korea did, they did the social distancing, but if you look at the difference between Italy and South Korea, because South Korea had dealt with MERS before, the testing was quickly pushed out. So I think that's why you see the numbers in South Korea different from the numbers in Italy. And so we are going to get to where we're going to be able to test many, many more people in our community. I do not have those numbers. And I don't know if those numbers are released by the state, so I wouldn't. Yeah, thank you. The council offices are all open. They, handle constituents before via online, via phone call. All of them are working. Their staff is working, whether it's either, separated a little more at the office or at home. So please use them as a resource. I am in communication with them multiple times a day, so they are certainly on the front line of this as well, and they know very, very current information. And I will say, I do think those of us who are serving the public, whether it's government, whether it's the business community, whether it's nonprofit, our medical community, we are going to get through this, and we all know the obligation that we have to stand strong for the community. I think all of us personally feel that as well, and so we are going to have an opportunity to shine and stand strong in this region. So thank you.